For joining us today. Today we are doing a webinar about advocating for vaccine prioritization for people with Down syndrome. Just a few introductions. So from Down Syndrome International, we have myself, Helen Powell, we have Aziz Akala, Nathan Rowe, and we are delighted to welcome our guest speakers, Fulya Ekmen from the Turkish Down Syndrome Association and Jessica Pereira Cardozo from the Brazilian Federation of Down Syndrome Organizations. So the agenda and what's going to be talked about today. Nathan has been going to give an introduction and some background and talk about DSi's Vaccination Advocacy Toolkit, and he's going to talk about some key advocacy recommendations. Then Fulya is going to talk about the work of the Turkey Down Syndrome Organization and the path of vaccination priority in Turkey. And then Jessica is going to talk about advocacy activities on vaccine prioritization in Brazil. And this is going to be followed by a Q&A session, and you're very welcome to ask questions or to send us questions in the chat box during the webinar. This is actually the second of two webinars from DSi. Last week, we did a webinar about the vaccine prioritization for people with Down syndrome. And this is where we presented results of our survey, and Professor Andre Stridham provided information about and evidence about prioritization of the vaccination programs around the world, and also some information about the vaccines themselves. So just a few things about this webinar. This webinar is going to be providing recommendations on how to advocate for vaccine prioritization for people with Down syndrome, and it will provide examples of advocacy campaigns by DSi member organizations, but it does not debate the pros and cons of COVID-19 vaccination for people with Down syndrome. A few more things. We believe at DSi that people with Down syndrome have the right to choose if they receive the vaccine or not. Information about vaccines should be obtained from reputable organizations, for example, the World Health Organization or national health bodies. And if there are any concerns about having a COVID vaccination at all, these should be discussed with a medical professional who knows your medical history or the medical history of the person to be vaccinated. A few key points about using Zoom. Attendees do not have the ability to speak, but you can say hi and make comments in the chat box. You can use the Q&A box to ask our panelists a question, and we'll try to answer these during the session. If not, we'll get back to you after the session. And if anyone has connection problems, please let us know. A recording of this session will be sent to all registrants afterwards, and we'll be also sending you a link to a short survey. We welcome all feedback. It's really important for us to get feedback, so we know that we're giving you the sort of information you find useful, and to make sure we're doing everything right for you. So I'd just like to introduce now Nathan, who's going to introduce this and provide a bit of background and information about advocacy. Thanks, Nathan.
Thanks, Helen. So yeah, just to give a bit of background, so the COVID-19 pandemic presents a major challenge to the implementation of the UN Convention on the Rights of Persons with Disabilities, and also to the realization of the Sustainable Development Goals with respect to people with Down syndrome. So what we have been seeing since the pandemic started is that people with Down syndrome are being left behind. And despite the evidence that is out there that people with Down syndrome are at a greater risk, not all countries have policies in place to vaccinate people with Down syndrome as a priority group. So this was something we talked about in quite a lot of detail in the webinar last week. And as Helen said, there's a recording available if you want to watch it, if you missed it. But yeah, this is a massive issue. In terms of what DSi is doing, so we are continuing and building on our work to provide up-to-date, accurate information, online advocacy training and webinars, also to give member organisations the opportunity to discuss advocacy strategies, which is what we're doing today, and plans through our International Down Syndrome Forum, and also building on and updating our resources. We think it's really important at this time to work together to have a united voice. So that means ensuring that the lives of people with Down syndrome are valued on an equal basis with others when accessing healthcare in line with the basic rights of persons with disabilities. And it's really important that policymakers and healthcare planners are aware of and understand the additional risks of COVID-19 for persons with Down syndrome, that they include people with Down syndrome and their support networks as a priority group to receive vaccinations, and that they involve people with Down syndrome and their representative organisations in planning and distribution of COVID-19 vaccinations and related processes. It's important that people with Down syndrome have the necessary resources to access a vaccination, that they can access information about the vaccine and the process in formats that they understand, and that they have the support required to enable them to make an informed decision about whether to have the vaccination. So by all working together, we hope that we will be able to enable more people with Down syndrome to have access to and to be included and prioritised in COVID-19 vaccination programmes around the world. So one key thing that we've been working on, as Helen discussed in our webinar last week, we worked on a survey of member organisations to understand the current situation with vaccinations, and we shared the results then. But another thing we've been working on is developing a toolkit, an advocacy toolkit, and this is a toolkit that people can use when advocating for prioritisation of people with Down syndrome for COVID-19 vaccines. The toolkit is out now. We'll be sharing it after the webinar by email, and we would encourage you to read it. But it includes suggested potential advocacy activities that could be done, evidence to support the need for prioritisation. A lot of this was covered in detail last week by Andre Stridham from the T21 Research Society. There's a whole wealth of evidence in the toolkit that you can look up that you could use in your advocacy work. There's also examples of what health and research organisations are doing and what disability and advocacy organisations are doing to give you ideas and hopefully some inspiration. And finally, there are supporting materials in there. So I'm not going to go through the whole toolkit in this webinar because we'll be sending it to you and we'd encourage you to read it and go through it yourself. But I'm just going to quickly go through a few key advocacy recommendations if you're running an advocacy campaign, of things that you could think of, and just a few ideas of what might lead to a successful advocacy campaign. And then we'll be hearing from Fulia and Jessica about what they've what they did in their countries, in Turkey and Brazil, to advocate for vaccine prioritization and the strategies they use. So I expect lots of my recommendations will be the kinds of things that they did in their campaigns. So number one, set clear advocacy targets. And this sounds obvious, but if you aren't clear on exactly what you want to achieve, it's very difficult to do successful advocacy. So first, you need to think about the problem you're trying to solve. And in this case, I guess for most of you, it will be that people with Down syndrome can't access vaccines in your country. But you need to go further than that. You need to understand what needs to change to solve the problem. What are the underlying causes of the problem? So is it that people with Down syndrome are not listed as a priority group? Is it that the vaccines are unaffordable for people with Down syndrome and there's no support for that? You need to be very clear on what you're trying to change to solve that problem. And then you also need to think about who has the power to make the change. Is it the Ministry of Health? Is it a different government department? Who is the person or organization or department that could make this change happen? So that's step one. Step two, I think it's really important to be clear on who you're targeting your advocacy at. So thinking of primary and secondary targets. Primary targets are the people who can actually make that change you want to happen. So in this case, it may well be the Minister for Health, who's the ultimate decision maker in prioritization, or maybe it's a part of the Ministry of Health. Maybe they have a committee that makes decisions about prioritization. But you need to be clear, who is it that you need? Who is it that can make that change and that decision? Because that's who you need to influence. And think who can influence that primary target. Is it members of parliament, influential politicians, or groups within the country? Maybe it's your community that you support and work with. So self-advocates with Down syndrome, family members, the whole Down syndrome community. They're a big group that could help you influence the decision maker. And also stakeholders such as the media stakeholders, like, is there a sympathetic TV talk show presenter who could help you campaign or something like that? So being clear who your targets are for advocacy will help you run a successful campaign. Also, I think using a variety of advocacy activities to reach your advocacy targets. So this could be lobbying, so directly contacting decision makers, maybe writing letters to them, maybe arranging individual meetings with them, maybe writing a statement by your organization about what you think they should do. There's an example statement in the toolkit that you can adapt. So we'd encourage you to have a look at the back in the resources section. It could be mobilizing people, organizing people to take action, to put pressure on decision makers. So that could be petitions, it could be marches, or different kinds of campaigns that you get other people involved in. Or using media, that could be traditional media like TV, newspapers, radio, or digital media, social media. These are really effective ways of mobilizing people and putting pressure on decision makers. And using not just one method will help your campaign. So we've got some more ideas of different activities in the toolkit. Using available evidence to support your campaign is really important. It adds weight to it. It makes it much more convincing. This could be international data on COVID-19, the kind of which was presented in the webinar last week. There's a lot of links in the toolkit to this kind of data. maybe also national data from your country, data specific to persons with Down syndrome, but also collecting individual narratives and stories from people with Down syndrome and their families in your country is quite a powerful way. And accompanying statistics with individual stories is really important. Also, use human rights commitments that your country has made. So all countries have made some kind of human rights commitments, and they've signed things, they've ratified conventions. The vast majority of countries in the world have signed up to the UN Convention of the Rights of Persons with Disabilities. So it's a really important one. Looking at that, Article 25, the right to health, is a key one for this particular issue. Also, the Sustainable Development Goals, particularly SDG 3 on good health and well-being, referring to those within your advocacy are a good way of reminding policymakers that this is an obligation they have as a government, not just something you're asking for them to do you as a charitable action. So it's important to reference those. Also, another thing that will strengthen your advocacy work is working together with other organizations in your country. So this could be other organizations of persons with disabilities or OPDs. So maybe are there other organizations representing different disability groups, maybe representing blind people, deaf people, people with physical disabilities. Maybe there's an umbrella national disability organization that you could work with. Working together will strengthen your message, so it's a good idea. Maybe there's NGOs working on similar issues. There might also be rights organizations in the country that could help with your advocacy work, or other civil society groups. Maybe representing women, for example, or Indigenous people, or different groups who might also be facing similar challenges. Working together can really help with your advocacy. Another key recommendation would be get your community involved. So by community, that's quite a broad term, but I mean all of the people with Down syndrome that you represent in your country, all of their families, all of the people they know. That's quite a big network generally that you can mobilize, and that will get behind you if you run your campaign well. It's really important, I think, using self-advocates and working from, if you're planning your campaign all the way through to delivering it, with people with Down syndrome, getting them involved from the start. And that adds authenticity to your work, to the campaign, because you've got the real voices of the people that are affected involved. But I think also it makes advocacy work more effective, and I'm sure that has been the experience of both Turkey and Brazil, that self-advocates being involved is really important. But also families and other people in the network, getting them behind the campaign is important, getting them to share your messages and add to the pressure on decision makers is really important. And finally, making it easy for people to get involved. So having an easy way that people can take action is quite important. Otherwise, they might agree with your campaign, but they don't know how they can help. So making it easy for people to help is a good idea. So all of these are quite general. We'd really encourage you to download the toolkit and to have a read through, because it's got so many resources on there, so much information and evidence and recommendations, which we hope will be useful. So really our key message is, let's work together. We know that across the world, there's lots of countries that are facing this similar issue around trouble accessing vaccines for people with Down syndrome and are struggling to get them prioritized for vaccines. So let's learn from each other and what's worked and what hasn't worked in different countries. If you have a story of what you've been doing with your advocacy work, we'd really like to hear it, and we can share it with other people, and hopefully we can all learn from each other and yeah, make these changes together. And on that note, I think that's a good time to introduce our first speaker. Stop sharing my screen a sec. So first up, we have Fulya Ekmen, and Fulya is from the Turkish Down Syndrome Association. So she is going to tell us about their advocacy campaign in Turkey and how they went about it. And yeah, can't wait to hear it. Thanks, Fulya.
Thank you very much. I'm very excited. I want to share my screen, my slide, PowerPoint. Yes. Let me arrange it a little bit. Okay. Hello to everybody. I'm Fulya from Turkey and Down Syndrome Association. Today, I'm going to talk about our journey through vaccination priority for the adults with Down syndrome in Turkey. I think we are one of the countries that give the priority very fast. But is it fast and easy in reality? No, we worked 5 months on it. Our path had full of hard work, lobbying, anger, happiness, and hopeless times a lot. How we began in November 2020, we shared 4 articles which emphasize the risk of COVID for the people with Down syndrome on our website, social media accounts, and directly with the members of parliament and representatives of Minister of Health. We shared these articles both in English and in Turkish. Honestly, I don't believe that they read them when we first shared because they didn't react. So sharing is not enough. It is not the end. It is just the beginning. Which articles were they? First one was the one published in Genetics in Medicine, which is titled Individuals with Down Syndrome Hospitalized with COVID-19 Have More Severe Disease. Second one was the one published in British Medical Journal, which is titled Living Risk Prediction Algorithm for Risk of Hospital Admission and Mortality for Coronavirus 19 in Adults. The third one was the one published in Annals of Internal Medicine, which is titled COVID-19 Mortality Risk in Down Syndrome, Results from a Cohort Study of 8 million adults. The fourth research was the one published was titled An International Survey on Impact of COVID-19 in Individuals with Down Syndrome, prepared by Trisomy 21 Research Society and published in Medaweeks and then in Clinical Medicine. And now I can send the links of that articles to you on chat. Yeah, let me change it. After sharing these articles in English and in Turkish, we saw that just putting and sharing the research are not enough, as lots of people don't want to read long scientific articles, and most of them can't understand. So again, in November, we shared an announcement referring these articles, describing the risk and answering frequently asked questions on social media accounts. And 21,719 people saw that announcement. We also invited government to take some precautions for the people with Down syndrome, like making similar research for Turkish people, giving priority for flu vaccination for the people with Down syndrome, and informing families, people with Down syndrome, caregivers, employers, health workers after evaluating this for research. Please note that in that time, we didn't have any vaccine in Turkey. First vaccination started in January 2021 for the health workers. That's why we wanted flu vaccination priority according to suggestion of our medical consultant in the first phase. At the same day, we sent petitions informing our demands to the different divisions of Ministry of Health, to the Scientific Committee of COVID-19, to the Ministry of Family and Social Affairs, Social Services. And also simultaneously, we sent these petitions and again the results of research to the members of parliament and heads of different divisions in the Ministry of Health and Ministry of Family and Social Services by WhatsApp. During COVID-19, we saw that technology is great advantage to reach people that you can't reach easily in usual days. So please try to use all kinds of communication tools to make pressure on people, but not too much, just enough of it. On December, we waited for any formal answer to our petitions. While waiting for an answer, we talked about this research in all meetings that we joined, and we prepared reports to the opposite parties and government, in which always was mentioned the importance of vaccination priority for the solution of inclusive employment, health, and education problems of the people with Down syndrome caused by pandemic. On the January 2021, after vaccination started in Turkey, we sent a new petition to the Minister of Health demanding COVID-19 vaccination priority by formal ways. Simultaneously, we sent these petitions to the members of parliament and heads of different divisions in the Ministry of Health and in the Ministry of Family and Social Services by WhatsApp again, and we informed other NGOs about our initiative. At the same day, we sent SMS to our families and shared a post in social media asking them to send letters demanding vaccination priority from Ministry of Health and the President. Generally, activating families are important but difficult. So we prepared sample of formal letters for them. They didn't have to do much work. I want to note that we always ask for the support of other NGOs, which works with different disability groups too. As we couldn't have an answer from the authorities, we sent a petition to Ombudsman about vaccination priority for the people with Down syndrome. And then our self-advocacy group recorded a video asking vaccination priority from government and shared that, and we shared that video on social media. Video watched by 26,220 people. On the 23rd of February, some members of the parliament presented their reports about Down syndrome, which was the result of the works of a temporary commission built in the parliament before pandemic. We asked some of them to emphasize the importance of vaccination priority for the adults with Down syndrome during their speech. They didn't. Only one of them who was the representative of opposite party, talk about severity of the situation and ask for some precautions. But this was something too. Those speeches can be watched live on TV channel of the parliament. And I think these broadcasts are observed by the presidency divisions. 2 days after this, we visited the president of that commission and asked his support face to face. And he directly wrote to the Minister of Health. And I want to make a note here, our head office and Turkish parliament are in the different cities. So we drove almost 4 hours to reach him. In March 2021, we organized a meeting with the same member of parliament for World Down Syndrome Day, and our self-advocacy group attended that online meeting. During the meeting, they demanded vaccination priority a couple of times, which was very affected on him. And again in March, we had a meeting with the leader of the opposition party. Families and self-advocacy group members attended that online meeting and request opposition parties' support for vaccination priority. Again, same thing happened. Repetition of same demand by different people influenced him. Once again, we sent SMS to our families and shared a post on social media asking them to send letters demanding vaccination priority from related ministry and public institutions and the president. During March, we attended some TV news, radio programs, or gave interviews for the World Down Syndrome Day. During these programs, we talked about vaccination priority and tried to create a common sense. Using special days are very important as media and public bodies focus on one issue and try to create agenda about it, even for a day. On the 26th of March, our self-advocacy group recorded another video directly calling to the president and shared it in social media. 24,082 people watched it. Just one day after that video, we had vaccination priority for the adults with Down syndrome. I think these last two people were President and the Minister of Health. And what we learned, scientific research are very important. These 4 research were helped a lot to understand what are the risks for people with Down syndrome in case of COVID-19, and also helped a lot to convince people by using scientific evidences. The survey were extremely helpful. By using its results, we said to the authorities, we are not talking by using uncertain future predictions. We are talking about the real cases that already happened. It was very helpful to us. We saw the power of science and research. We should find a way to support those initiatives as NGOs. To be honest, this is the weakest part in our association and nation. Maybe you are too bad. This is not an excuse to wait. Follow international bodies, find research and translate them and share them as we do. Create a common language. What we did was to create a common language about vaccination. We informed families to be aware of their children's needs of vaccination. Also, we informed adults with Down syndrome. People only ask for anything after realizing them they need it. Inform families and guide them to see the need for vaccination. Then families begin to ask for it from government, and government begin to hear what you ask if the same demand comes from many numbers of people from different places. It is better to be crowded. Don't walk alone. And take care for other NGOs. Share your knowledge with other NGOs. Then ask support of them and give your support when they ask. Use technology to reach people from different pressure points. Social media, WhatsApp messages, WhatsApp groups, online meetings, there are many options. Try to expand your options. Motivating families are important but difficult. Guiding and informing is not enough. Sometimes people are reluctant about taking action. So prepare petition, letter, social media messages samples instead of them, and let them copy paste it. Make it easy, be facilitator. And use your network and create new ones. First, motivate people in your existing network to act, then try to find new ones. Politicians, press, families, people with disabilities, NGOs, public bodies, members of parliament, representatives from other NGOs in other countries like DSi, ETSA, Mayor Network. Use your legal rights and be aware of both national law and international conventions like Convention on the Rights of Persons with Disabilities, and always refer the related articles of them in your petitions. All political parties are valuable. Try to reach both government and opposition party representatives. In our case, government acted when they saw that opposition parties were about to take credit for it. And update yourself and your network. This is the way to show your expertise about the subject, to show you are still on it, to create common sense such they may start to believe that this was their opinion, like a brainwash session. And use self-advocacy groups. This is the last but most important item for the advocacy works. Create self-advocacy groups and empower them, then let them speak. Their one word may be more effective than whole paragraph you say. Thank you very much.
Thank you very much, Fulia. That was a fantastic campaign and fantastic presentation. And I think probably encouraging, I know there's a few of our members on, I can see in the participant list, who are trying to campaign for prioritization at the moment. So I'm sure that's going to be really useful, seeing how you got there. And it wasn't an easy journey by the sound of it. It took a while to get your momentum going. So yeah, congratulations. It's really, really amazing. So we're going to go to another presentation now, but if you have questions for Fulia, please feel free to write them in the Q&A section, and then she can answer them at the end of the webinar. So we're going to go over to Jessica Pereira Cardozo now, who is from the Brazilian Federation of Down Syndrome Associations, who have also been campaigning for the prioritization of people with Down syndrome for COVID vaccinations. So over to you, Jessica. I'm just going to share my screen so we can see your presentation.
Hello, everyone. Good morning here from Brazil. Can you hear me?
Yeah. Can you see the screen?
Nice. Yes.
Cool. Let me know when you want me to move to change slide.
Okay, I'll tell you. Good presentation, Ekman. We had similar strategies here in Brazil also. And first of all, we would like to thank DSi for the invitation to share a little of the steps that Brazilian Federation of Down Syndrome Association has taken to vaccinate Brazilians with Down syndrome. And we also want to register our solidarity with all the families who suffer because of COVID-19 around the world. FBAG, it's how we abbreviate our federation, has existed for 27 years. And today brings together 40 affiliated institutions across the Brazil. Currently, our country is at the mark of more than 550,000 deaths, and only 18% of the population is immunized with the 2 doses of vaccines. Since the beginning of the pandemic, our federation has treated the coronavirus with great seriousness and concern. We are always on the lookout of updates regarding the impact of the coronavirus on people with Down syndrome. However, our government and our president of Brazil had a slow response in terms of preventing the spread of the virus. At the times, it was even denial, the pandemic and the coronavirus, which is why all Brazilians were harmed. As the pandemic was getting progressed, we dedicated ourselves to organizing actions so that the Brazilian government should prioritize vaccination for our public in view of health's particularities. Could you go to the next one, please? We can divide our actions into 4 main spheres, with information, articulation, and dialogue was support of these actions. The Federation's board conducted all the actions, but always relied on the presence, ideas, and voices of people with Down syndrome for the development of activities. First of them, we seek to rely on scientific and reliable information about COVID-19. We participated in the T21 research study and encouraged Brazilians to contribute. We followed all the updates about the studies and shared them all the time with our federates, our institutions, and on social networks. Second, we seek legal support in Brazilian legislation, and call up responsible bodies, such as the Federal and Supreme Court and the Ministry of Health. To present scientific evidence, claim to the right to prioritize care and guarantee the life of hospitality people in serious condition. In the first months of the pandemic, as everything was new, we were not successful in this context, but at least we're already demarcating our position and declaring that we would defend the right to priority of the vaccine against COVID-19 wherever and for as long as necessary. The answers recognized the need of vaccination, but they were always saying about the little amount of doses that our country was having. Next, please. The third action, we made some contacts exposing the risks of COVID-19 for people with Down syndrome to governors, mayors, and health secretaries. We created a great chain of mobilization and information to all national authorities. Through the pandemic, these actions gained a large proportion of recognition of the importance of care and respect for people with Down syndrome. Fourth, we need to mention the massive work in the media. Our federates, our institutions, and people with Down syndrome was always helping us in this process, sharing a lot of news and calling their local authorities in search of vaccination. Next. Here is a demonstration of how much we really appreciate scientific studies, taking this information in a very valuable way. So we participated in the T21 research, as I said before, and released all the preliminary results, organizing a website with information about COVID-19 and a book with easy read informations of prevention. Next. A very powerful action was the mobilization of our associations and partner institutions. We kept everyone updated on our actions and inviting them to participate and disseminate the studies and what we are doing. A good communication channel were videos of our president transmitting updates and requesting engagement in the campaigns we organized. This is the picture of our president. Next. In this year of 21, we leveraged our actions with the support of Down Syndrome International, and we were able to create a very even bigger campaign. The idea of the campaign and its creation came from self-advocates aiming to focus on the media. That's what they said. We need to go to the media. We need to get seen, to disseminate information about the risks of COVID-19 and the importance of vaccination. The campaign was titled with the hashtag "I demand a dose of respect," with the objective to get all the people with Down syndrome vaccinated immediately. This is what the circle here is saying in Portuguese. Next, please. At this point, from the beginning of the campaign, vaccination began to take place in the campaign slogan, social networks, website, and our websites, WhatsApps, sorry. Next, please. We performed 24 posts and 89 clippings. Little by little, cities began to recognize the priority and start vaccinating, as shown in this first image on the left. We made a point of echoing each city. We published an article on the largest news portal in Latin America, which also ensured the great repercussion. Another mobilization was the development of a petition requesting the prioritization of the vaccine. We obtained more than 13,000 signatures, as we are showing on the right image. Next, please. On this page, we can show some clippings of articles published in the main national newspapers and media. Everyone draws attention to the importance of the vaccine and reports on the I Demand a Dose of Respect campaign. Next. Our self-advocates had a great participation in the campaign, published videos, posts, participated in meetings with authorities in search of vaccination. And these images are from videos we published through the campaign. After all these actions mentioned, the Ministry of Health included people with Down syndrome in the group of people with comorbidities in the National Immunization Plan, which meant recognizing the need for greater care for this group. Finally, in April of this year, a note was released recommending the prioritization of the vaccine after the vaccination of those over 60 years of age. Next. So now, after getting vaccinated people over 18 years old, we continue the articulation so that adolescents over 12 years old are also vaccinated. We are following the same strategies with articulations and meetings with the government, bringing scientific evidence and pressing for people with Down syndrome to have priority guaranteed. On the left side of the image is the letter we sent to the authorities here. Next. To conclude, I showed that as facilitators, we rely on the production of scientific research, the mobilization of engagement of the Federation's board, the union of the affiliated institutions, families and partners, and the focus of major investments in social medias and networks. Again, we want to say thank you to Down Syndrome International for all their support, and we are available for contacts and questions, and you can also follow us through these links on social media. Thank you very much for your attention.
Thank you very much, Jessica. What a brilliant presentation and a brilliant campaign. I love the I Demand a Dose of Respect slogan, and that it was led by self-advocates from the beginning, and it was a really powerful message. So it's amazing. Thank you. It's great as well how you use so many different kinds of media and traditional media and videos on social media by your president and by self-advocates, and so many different ways of coming at it. It's really amazing. So thank you. So we're going to move on to questions now. So I'm going to hand over to my colleague Aziz to do the questions. I'm just going to share my screen again, 1 second.
Hi everyone. So we currently don't have any questions at the moment, but we can wait if anyone would like to ask any. So if anyone doesn't have any questions currently, please feel free to email me and drop me a question later on. Thank you.
So doesn't look like we have any questions right now, but we'll be posting recordings. So if you're watching this as a recording, feel free to email us with questions, and we can pass them on to Jessica and Fulia. But yeah, I'd just like to say a massive thank you to Fulia and Jessica for your fantastic presentations, and congratulations for your campaigns. It's amazing. These campaigns will have saved lives. So the impact is enormous, and it's really amazing work you've done. So thank you so much for sharing it with us. Okay. Do you have anything else you'd like to say, either of you?